Hi, my name is Rania Salman and I'm a registered dietitian based in the UK. One of my specialist areas is PCOS, which stands for Polycystic Ovarian Syndrome. In this video, I'm going to explain what PCOS is, what symptoms women present with, and how it's diagnosed, and the way nutrition can help improve symptoms. So let's get started. PCOS is a syndrome, which means it's a collective of symptoms that actually affects up to 1 in 10 women in the UK, which is quite a big number. And in order to be diagnosed here in the UK, we go by something called the Rotterdam criteria. And with this diagnosis, you need to present with at least 2 of the following 3 criteria, and that's how you get a diagnosis of PCOS. So what is the criteria? So the first thing is absent or irregular periods. If you present with one of those, that would be one of the criteria. The second criteria is seeing loads of what people think are cysts, but are actually loads of follicles in the ovaries on an ultrasound. And the third criteria is either presenting with high levels of male-like hormones, either biochemically, so you can see that in a blood test, or clinically, so you might present with symptoms such as excess hair growth around your chest area, around your stomach area, your inner thighs, and even your face. If you get 2 out of those 3, then your doctor would diagnose you with PCOS. So when it comes to the symptoms that women get, there can be quite a big range, and they can range from things like having excess cravings to being extremely tired throughout the day, having headaches, mood swings, anxiety, having things like skin tags, and what looks like pigmentation around your neck area and your armpit area, amongst other symptoms. Now, in the age that we live in today, there's a lot of misinformation rife online, and that can make it really hard to figure out what the best nutrition strategy should be when it comes to PCOS. 1 minute you're being told to go gluten-free, the next minute you're being told to cut out dairy, and actually most of the time you're being told actually everything is going to make your PCOS worse. So I can understand the frustration that you must feel when it comes to managing and dealing with your PCOS. And just like the right nutrition strategies can help improve your symptoms, the wrong ones can actually make things worse. So when it comes to PCOS, here are my top 3 tips that can help get you started. My first tip is to try and choose low GI carbs. So GI stands for glycemic index, and what it basically means is how quickly a carbohydrate is broken down into glucose, which gives us energy, and how quickly that glucose is absorbed into our bloodstream. If it's absorbed really quickly, it means you get a quick peak in your blood sugar levels and then quite a crash, more or less. We want to avoid that. What we want is the release of glucose into our bloodstream to be steady throughout, giving your body time to effectively deal with that energy that it's going to get. And so by switching to low GI carbs, which are often whole grain carbohydrates, you're making it more gentle for your body to be able to deal with that carbs, and you're going to get a sustained energy release over a longer period of time, meaning you're going to keep your cravings at bay and you're not going to get that fatigue that you might always feel. My second tip is to balance your meals properly. I've looked through thousands of food charts in my career, and one common theme is that we load our plates with carbs. So like I said, I'm not saying we can't have carbs, but the reality is we're having just too many carbs and we're not balancing our plate properly. What we're looking for is for about 1/3 of your plate to be whole grain carbs, 1/3 of your plate to be protein, and 1/3 of your plate to be some kind of vegetables, whether it's a salad, whether it's cooked vegetables, roasted vegetables, or just vegetables mixed in. We want to bulk your plate up with vegetables. And the reason behind that is protein helps keep you full for longer, so you're less likely to want to reach out for that extra snack in between meals. The vegetables, the fibre, help to slow down the release of food from your stomach. Again, meaning that you're less likely to feel hungry later on, but you also get this sustained release of energy, keeping you going for longer. And here's my third tip. If you're a fan of cinnamon, it's definitely something you want to start having more of in your diet. And that's because cinnamon has been shown to help reduce insulin resistance. And if you haven't heard of the term insulin resistance already, then it's something you need to know about. So for up to 90% of women with PCOS, insulin resistance is one of the key drivers of their symptoms. So anything you can be doing to help reduce your insulin resistance is going to be a win-win. Now, with cinnamon, it's quite diverse in the way that you can use it. So some people add it to savoury dishes, for example. Some people will add it to things like their breakfast cereals or even their snacks like yogurts. What studies have shown is that you're needing to use about a teaspoon a day to help reduce your insulin resistance.